Originally, I think you were in favor of the Medicare Part D.
I was.
Correct, but then you're not anymore, so.
Well, what I said was, I supported Medicare Part D for a lot of reasons. But there were reasons I didn't like it and, was borderline on not supporting it. The biggest reason was I didn't think we needed a comprehensive Medicare drug benefit. Number two, and even more important now, is that we should have paid for it, and we did. But I voted for it because there were a lot of other things in the bill, and the representative would tell you, oh, would it be nice if we had bills that just had one thing in it and you could vote yes or no on the one thing. But sometimes, as in the case of the Medicare prescription drug bill, it had umpteen things in it. And some of them I didn't like, some of them I was fighting for 15 years. One of the things I was fighting for 14 years was health savings accounts. I really believe that that is the transformative idea that will ultimately be how we base our healthcare system, the private healthcare system, and frankly even the public healthcare system in America, to get consumers back involved in the purchasing of healthcare. And that was, to me, a big idea. I authored the first, what was called medical savings accounts back in 1992 with John Kasich, who's now the governor of Ohio, and have been an advocate for it for, like I said, more than a dozen years. And we had the opportunity with the Medicare prescription drug bill. They were looking for things to try to attract votes like me who didn't like the bill. And so the health savings account was a huge attraction to me to vote for this, to try to establish that policy. Second, we reformed the Medicare system, which was a big deal, to allow for something called Medicare Advantage, which was a private sector alternative to the Medicare program. Another big reform in my mind that could help transition us away from a single-payer, government-run Medicare system to one that was more defined contribution to give X dollars to the Medicare, to the senior to go out and purchase their own health care. I saw that as a transitional program in the Medicare field. Number three, the design of the Medicare Part D program was designed like Medicare Advantage, which was not a single-payer government-run Medicare prescription drug program, but a subsidy program where seniors went out and bought their own Medicare prescription drug policy. So the design was great. It's consistent with what I thought the design should be for overall Medicare. We had a change in the fundamental change in the Medicare system. We had a fundamental change in the private sector healthcare system, and then we had this bad not paying for Medicare. And look back and I said, probably shouldn't have voted for it because of the impact on the deficit. But at the time, we had just had 4 years of surplus, and the deficit picture wasn't looking nearly as bad as it looked right now. And I thought that if we could get these structural reforms into the Medicare program, that would actually save money over time vis-a-vis the money we were putting into Medicare. So that's why I voted the way I did. I said at the time it was a 51-49 vote. But that's some of the votes you cast are like that. You vote for good things, you vote for bad things. In the end, I wish I could have gotten it without having to spend the money, and would have voted no because of the money, given the deficit situation we're in right now, and given the fact that Barack Obama has peeled back Medicare Advantage, almost eliminated, and has crippled HSAs so they're not as functional as they used to be. So future Congresses have in a sense, undermined the reforms that I helped put in place, which is the reason, given everything I know now, I would have voted no.